SDOH Academy 2021 Breakthrough Series. My name is Bellany Reese. I am Project Manager with Health Outreach Partners, and my colleagues and I are excited to have you join us for the third of a four-part series to talk about reducing health disparities through community partnerships. Next slide, please. Great. Just quickly before we jump in, we want to review a few housekeeping details, even though I'm sure that we might be quite familiar with Zoom webinars by now. But just a quick note that this webinar will be recorded. The PowerPoint slide deck and resources are available for download. And we would love to have you all contribute, participate in the discussion today with us. And so there's a few different ways that you can do that. There's the chat function. Feel free to put comments in there. Also, if you have questions for the panelists or the presenters for today, please go ahead and put those in the Q&A pod so that we can keep track of those and make sure that they get answered. Also, feel free to use the reaction buttons, raise your hand if you would like to say something, and hopefully we can find some space to let you jump in and chat with us. And we just want to acknowledge the new realities of where we're all living and working, and that they very well might be in the same exact place. So if you have any visitors or any interruptions, be they digital or background, we totally understand. Just know that we support you taking care of whatever you need to take care of and taking care of yourselves. Next slide, please. We would like to acknowledge the Health Resources and Services Administration for their support of the SDOH Academy, its activities, and all of its faculty organizations. Next slide. Now, if you weren't able to join us for the first two webinars in the series, here's just an overview of the Breakthrough series itself. Now, we know that there is a lot of information, a lot of resources, a lot of links to experts and webinars and things of that nature to address the social determinants of health. And so we wanted to use this series to break through the deluge of emails and really bring you, highlight the resources that we think are timely and useful. Here's just a little more information about the series. Each of the webinars is structured to provide about an hour of content, followed by an optional 30 minutes of office hours where faculty are available to answer any questions and facilitate additional discussion around the competency. And each of the webinars will be recorded and posted to the SDOH Academy website. And you can visit the link at the end of the presentation to register for the fourth and final webinar. And here are all of the faculty partners, the National Training and Technical Assistance Partners. Next slide. And today I'm joined by my colleagues Saki Cho from the National Center for Health and Public Housing, Ariel Mather from the National Center for Equitable Care for the Elders, and Bethany Hamilton with the National Center for Medical Legal Partnerships. They'll be addressing the third of four SDOH Academy core competencies, which is enhancing population health and addressing health disparities through community partnerships. Here are the learning objectives for today's webinar. We hope that you will come away from our session equipped to identify and utilize key SDOH Academy resources for community partnerships, that you will have a better understanding of how to build community partnerships to address SDOH, and that you'll have greater capacity in the integration of services to address SDOH, both within and beyond the clinic setting. Here's just a quick look at our agenda for today, which we will get into in just a moment. But first, we want to recognize who's joining us today. So it looks like out of about 200 registered participants, most of you are, or hopefully will be, first-time visitors to the SDOH Academy website. Next slide. It also looks like the majority are also new to SDOH Academy activities. So welcome. We are so glad to have you here with us today. And here are some of the questions that you all have for us. And hopefully during our presentation, we will be able to address some of these. And if not, hopefully during office hours as well. And now, to help us get to know you all just a little more, we're going to have a quick poll question. So if you could tell us what type of SDOH training and technical assistance would be most helpful for you and your health center or your organization, we'd love to know. I'll give just a couple seconds for everyone to answer. Oh, wow. It's looking like a little bit of everything at this point. Okay, we'll give just a couple more seconds for any last minute responses. All right. Okay, so we can see that live virtual events just barely wins out, but it looks like a little bit of everything. So thank you so much for sharing those needs. It's really helpful for us as the Academy as we plan future events. And then we have another poll. We would love to, in the spirit of today's topic, we would love to know who you're currently partnering with in your community to address your patients' needs. All right, we have almost half of you have responded, so we'll give you another, we'll say 15 seconds. You might have more than one, so it's hard to choose. All right. So it looks like the majority are partnering with nonprofits or CBOs, which is interesting, and then also with health departments. That's great. And then a little sprinkling throughout. So if, or we hope that, you know, that you all will come away with some information that maybe you can apply to one of your existing partnerships or maybe some future partnerships as well. And now I will go ahead and turn it over to Saki to help us dive into our content for the day.
Thank you so much, Bellany. So I would just like to start by echoing what Bellany said. This webinar is the third in a series from the SDOH Academy. The first webinar was on improving access to care and really discussed the SDOH screening process, the importance of documenting social risks in order to address them. So how we collect data, track needs, and develop interventions. Next slide, please. The webinar also described how SDOH data can be used to inform interventions from the patient level all the way down to the policy level, and just briefly describe the importance of using data to connect patients to community organizations at the care team level, to communicating and collaborating and exchanging data for continuous patient care as far as the local health system goes. There's much more described in the first two sessions, so I encourage you, if you haven't taken a look yet, to review those recordings. Next slide, please. So these core competencies were designed with addressing health inequity in mind, and this particular core competency, improving the capacity of health centers to build partnerships, is a component of that SDOH screening process. So after you've identified the social risks that your patient population is facing and begin to identify the appropriate interventions to address those social risk factors, it's really important to remember that you don't have to develop all of your interventions in-house or do the work on your own. Partnering with an organization who's already developed services and programs that address social needs can be a great way to both get the patient's social needs met and also lessen the resource burden that's placed on your health center. And in many cases, there's no real point in recreating the wheel. And as health centers form partnerships with organizations outside of the medical care setting, our system will increase its ability to not only manage disease, but address all of those factors, all of those social determinants of health that lead to poor health. Next slide, please. So that's why we just want to highlight some of the resources and activities that were developed by the SDOH Academy. I'm just going to walk you through two main activities. The goal here is just to show you what's currently available an overview of the content to help you decide if it would be valuable to view at a later time. And then my colleagues, Ariel and Bethany, are going to build on some of those concepts in just a few minutes. So the first one I'd like to discuss was developed in April 2020. We hosted a learning collaborative to help health centers, PCAs, and HCCN staff enhance population health through partnership development and improved service integration. This learning collaborative was led by Capital Link, the National Center for Equitable Care for Elders, and the National Center for Public Housing, and the National Center for Medical Legal Partnership. It's called Reducing Health Disparities Through Community Partnerships. So the first session focused on an overview of the issues, the importance of forming partnerships with stakeholders who share a commitment to improving health, the community that they serve, and also have an important social role. And we discussed the steps of building and sustaining partnerships, including mapping your medical neighborhood, creating care maps for patients and populations, identifying which community organizations play a role in those care maps, and then operationalizing the partnerships by either creating a shared protocol or a memorandum of understanding. We also talked about the levels of partnership, thinking about collaborations as a working relationship that lies on a continuum of networking or coordinating or cooperating and collaborating, and realizing that as you move across the continuum, each might require an increase in time or trust or turf sharing, but also the potential to accomplish something together that you might not be able to do on your own. And then finally, we also discussed the tips for nurturing, maintaining, and evaluating partnerships. And we shared some case examples from health centers. And again, Ariel is going to go much deeper into the resources that were developed as a result of this learning collaborative and talk more about partnerships. Next slide, please. In that second session, we focused on the implementation and strategies and fully featured two presentations that discussed partnerships. And the first one was between Brockton Neighborhood Health Center and the Vicenti's Tropical Grocery Store, which focused on improving access to healthy food. And then the second presentation was about medical legal partnership, not only the components of a successful MLP, but also how to build electronic referral systems and connect with the EHRs. And Bethany is going to spend a lot more time talking about MLP and a partnership during the COVID pandemic in just a few moments. Next slide, please. So I just want to provide just a little bit more detail on the Brockton Community Health Center and Vicente Foods partnership, just because access to healthy food is a common challenge in many communities. And in this example, Brockton teamed up with Vicente to create a complex that included a health center and a grocery store. And they were able to do this through a $22 million combined investment that was financed through the New Markets Tax Credit, through a tax-exempt bond. And this partnership was heavily influenced by the community. It was located in a food desert, and it provided a wide variety of fresh foods from over the world, reflecting the needs and the diversity of the community members. But the partnership was also focused on improving health, particularly for diabetic patients. So the grocery store provided nutritional guidelines and labels on shelves, and then the health center also provided nutrition education through a teaching kitchen and staff that was staffed by dietitians and health workers. There's also a rewards program at the grocery store to encourage healthy choices, and also food prep and demonstration and educational events that were hosted by the health center. So as a result of this partnership, there was an increased access to medical care because of the location of the health center and healthy food in the neighborhood. Also improved safety because the storefront and the health center had occupied a previously vacant property. There were 200 new jobs for people in the community, but also better diabetes management and control for those patients that participated in those nutrition and cooking groups. So tune into that session to get more details about that example. Next slide, please. Thank you. So in 2019, we focused on building community partnerships to serve older adults, and we hosted this series to provide health center staff with tools and strategies to initiate, develop, and sustain community partnerships to better serve older adult residents and residents of public housing. And this learning collaborative was led by the National Nurse-Led Care Consortium, the National Center for Equitable Care for Elders, and the National Center for Health in Public Housing. Thinking about really the key considerations for residents of public housing and elderly populations in particular, but also tackling those components of partnership building that could benefit all types of patients that are served at a health center. Next slide, please. So now we're going to talk about some examples of partnerships that have occurred because of the COVID pandemic. The pandemic really has highlighted the large inequities in health and access to care, as well as the structural and the social determinants of health. So some of these partnerships existed before COVID, and because of the strength of a previous working relationship, they were able to pivot to COVID-related issues. And then other partnerships were new and occurred because of the challenges related to COVID. Next slide, please. So this first one is at CommuniCare Health Center in San Antonio. That the impact of COVID in this particular region and among their patient population, which included Hispanic, Latinx, African-American patients, and public housing residents, was that many of their patients were in public-facing jobs, so they were more at risk of contracting COVID. The health center itself had challenges related to turnover and loss of employees, as well as the need to find capital and increase their capacity to go virtual. And there were, of course, many challenges related to vaccine supply, which still continue. But they also saw a drop in their well child visits. So the health center formed a partnership with their housing authority to increase outreach and education to public housing residents, amplifying the message that it's important to maintain these well child visits even during COVID. And that relationship and partnership is important because there are many ways to notify and reach out to public housing residents through a housing authority partnership, collaborating with resident managers to make sure health education events are publicized during community meetings, or signage is placed around the property, or ensuring that public housing residents are aware of the health center and the services that they provide at lease signings, for example, or even working with a housing authority to share space at a housing site to do screenings or education events on site. All of those options have the opportunity to improve health and wellness for patients. Next slide, please. So this next example is from Med Centro in Puerto Rico, where earthquakes had impacted the delivery of health services way before COVID hit. And similar to CommuniCare, they saw a decrease in their cancer screenings and patients really afraid to come to the health center for primary care services. So to address their patient needs, they had to partner with multiple agencies, the health department, the National Guard, to get mobile units out and bring services into the community. And they did this by using certified nurses to deliver vaccines, pharmacists who went to the community to provide care, not just for COVID, but also for diabetic care. So thinking about preparedness plans, it's important to identify what community organizations and agencies to have on board, what their roles will be prior to any kind of disaster is incredibly important there. Next slide, please. And this last example that I'm going to provide is from El Rio Community Health Center, which is located in Tucson, Arizona. They have a large Hispanic and Native American population, and they found language barriers to be a real problem for some of their patients. They, like many other health centers, had to increase their telemedicine services, and it affected screening and appointments for their patients with chronic conditions, as well as they experienced challenges with their vaccine supply. So they partnered with state and local health departments and faith organizations, and they used promotoras for COVID health education. They had to provide culturally appropriate staff training and education, and then they used their EHRs to communicate out about vaccine availability. So the thread for this example is the importance of cultural humility, language access, partnering with trusted faith-based organizations, and using promotoras who are rooted in the community to carry out the important health messages. So now I'm going to pass it on to Bethany to talk about medical legal partnerships.
Thanks, Saki. Hi, everyone. Good to virtually be with you all again today. Where Saki talked about community health center level partnerships that you all are, we hope you'll continue to take up and expand. I want to help you expand into utilizing additional disciplines to really partner with and carry out reach for some of the partnerships that Saki even mentioned. So for those of you not so familiar with the model called medical legal partnership, this is where we are looking at embedding lawyers as members of the healthcare team. That way you can get to the legal assistance that's needed by individuals who are being served by health centers, looking at training the health center workforce to better respond to those broad social determinants of health that were highlighted in the examples, looking at the clinical level changes that can occur, such as not just value-based care, but really increasing the quality of care that's provided, and then going all the way to this systemic or policy change that was also highlighted in some of the slides that were presented earlier. This is how we think you can get to those healthier patients in the community, strengthening of the health center workforce, and really improving health equity measures around the country. So we would implore those of you who have not yet engaged in a medical legal partnership to look as lawyers as your friends. It's not always adversarial. And in fact, poverty lawyers have been doing this for a long time, really addressing those social determinants of health needs that can be resolved using a legal intervention. Okay, so for example, right, we heard Saki talk about food insecurity. You do have, in some cases, an individual applies for, as many of you might be familiar, SNAP benefits, and they're wrongfully denied, or perhaps it's cash benefits, or perhaps some of you are doing outreach and enrollment, and you're running into your client or your patient is running into problems getting coverage in the first place, or getting some sort of service reimbursed. This is what we like to call in our iHelp chart, the income and insurance issues. And these are places where lawyers can definitely help. And you continue to see in our iHelp chart other examples, such as because of COVID, we knew, because it has always been the case that low income populations, and those are who are particularly vulnerable for one reason or another, would have be facing evictions or housing instability or unsafe housing or utility shutoffs, right, which make housing just uninhabitable. These are obviously places where throughout the COVID pandemic, lawyers were able to, who were already partnered with healthcare organizations, especially health centers, immediately lift up those partnerships to be able to better respond to the needs of the patient populations. And you can see, I won't walk through every single detail on the iHelp chart. It is on the National Center for Medical Legal Partnerships website and in several of our briefs, including one of the tools that we'll highlight today, the Bringing Lawyers Onto the Health Center Care Team to promote patient and community health. All right, so the example from the field that we wanted to highlight occurred in the state of Texas, and it was certainly helpful to not just have this medical legal partnership, and it's several of them there in the Austin area and throughout, but it was not just helpful throughout the COVID-19 pandemic to have this partnership in place, but also during the big freeze that they just went through. Having the medical legal partnership in place, however, during the COVID-19 pandemic allowed the healthcare and legal teams to work together to be able to address that increase in unemployment, the increase in threatened evictions and foreclosures, and then certainly what we knew what would occur, which is the impact on health. So the threat to health and well-being, and the inability, if folks are out on the streets, if folks are in unstable or unsafe housing, or if they don't have income, right, that inability to really address and flatten the COVID-19 curve. So one of the things that the folks in Texas at People's Community Health and their legal partners managed to do was really work with within their jurisdictions to successfully move for emergency rulemaking for a statewide directive around utility shutoff protections. And as I mentioned, when I had begun to highlight this particular example, that came in handy, as you can imagine, during the big freeze where folks were left without lights, without electricity, without heating that they needed right away. So this was certainly timely, and perhaps as the folks down at this MLP would say, it was long overdue. I would encourage everyone to take a look at what the folks in Texas did. Of course, we know the regulatory situation down there is a little bit different, but I'm sure this is all quite helpful to many of you working with your patient populations to address their housing insecurity and instability issues. All right, so what's the resource that's going to help you know how to do many of the things that we've highlighted since I am speaking, I'll go into what the National Center did first to help you really build your medical legal partnerships. Many of you have probably tuned into our 5-part webinar series at the National Center. But we wanted to highlight it to those of you who are more familiar with or connected to our SDOH Academy. So we put out a Health Center MLP toolkit. The longer name of this toolkit is Bringing Lawyers onto the Health Center Care Team to Promote Patient and Community Health. We know you're doing the screenings. Many of you are using Prepare. Some of you are using accountable health tools that we highlighted in the first of our SDOH Academy webinar. We know that the next question that you all are naturally asking is, what do I do? Where do I go? Who do I partner with? And how do I form that partnership? If you are thinking about forming a medical legal partnership, and I strongly encourage you to consider doing so, and the partners look very different, take a look at our toolkit, because it does walk you through what we found to be the basic questions you need to ask, those conversations you need to have, and with whom are you going to have it. So you can see some of the table of contents highlighted on the screen. This is hyperlinked, and so for those of you who are in the chat box, go ahead and feel free to click on that, download it right away, and let other folks know that there are interventions for the problems that they're screening and finding in their patient populations. The image on the screen is, we just wanted to highlight for you examples of what we provide in the toolkit. It's not just words, we also provide images. If you're like me, I like to see a lot of graphics to really show exactly how this works. So as you've heard many of us highlight, the food deserts and food insecurity issues, we know that's a social determinants of health problem. And there are needs, such as, simply put, a family's need for fresh produce, and what a lawyer can do. A lawyer might be able to come in and help a family file an appeal after SNAP benefits were denied or incorrectly cut off, or perhaps it wasn't even calculated at the right amount. So those are the sorts of things that lawyers can do. These are just the basic components of medical legal partnership, because we know, again, right, sometimes it helps to just see this laid out. These are the sorts of graphics, as well as just conversations that are spelled out in lots of verbiage in our toolkit. Just wanted to highlight it here for you today. And then finally, you will see some more about that Texas medical legal partnership with People's Community Clinic and what they're doing down there. In the toolkit, we go into a little bit more detail, however, about how they really built that medical legal partnership. And so I just want to let those of you on the webinar today know that for any of the partnerships we talk about, we know these don't come about overnight, right? And they evolve, they continue to improve along the way to continue to be able to effectively address the patient's needs throughout the community. So I want to encourage you all to keep going, keep doing what you're doing. There's nothing wrong with your timeline or the pace with which you are moving to formulate these partnerships. The COVID-19 partnerships that we highlighted today, they were very responsive, they were very focused, right? But go ahead and take your time to continue to build upon what you're working with in these evolving situations that continue to come up as we face a pandemic or every epidemic or economic downturn around the country. All right, so I'm going to turn it over to my colleague Ariel so that she can tell you about another type of partnership. Ariel?
Yeah, thanks, Bethany. I'm wondering if we even might pause for a second, because I see we have a question in the Q&A about MLPs, and just because we're still on the topic, maybe you want to take a minute because we have plenty of time.
Sure. So bear with me because I'm also doing the slide management. If you don't mind, Ariel, reading it out for me,
Yeah,
that'd be super helpful. Thanks.
So someone asked, would these attorneys you partner with be different than an attorney that's already affiliated with the healthcare agency?
Oh, that's a great question. I'm just going to, Ariel, if you don't mind, move backwards away from your slide to the component slide of MLP. So in the toolkit, and then also on SDOH Academy's website, you'll hear highlights about, like, where are the lawyers, right? Who are the civil legal services attorneys that you're utilizing? So for example, some health centers have legal staff that work on regulatory issues compliance for the health center. They represent the health center. They don't represent, and this would certainly present a conflict, the health center's patients, for the health center's patients' legal needs and issues, whether that legal need or issue arises from the health center itself or from some outside entity or need. And typically that's the case. It's an outside entity or need, like a social need. So who are the legal partners? Even if you do decide to bring that legal partner, like a civil legal aid organization partnering with you, give them space in-house. That's still a separate entity. You do have examples, however, like Whitman Walker Health Center in Washington, D.C., where everything is all under one roof. Again, however, that medical legal partnership attorney is not representing the health center. They're representing the patients for those specific social needs that are identified that would help to reduce the health harming legal needs and increase their or improve their health outcomes. So you have civil legal agencies, civil legal services organizations, sometimes law schools, sometimes pro bono attorneys at law firms who really set up a regular relationship for referrals and services and counsel and advice to the patient population. So great question, really appreciate it was asked. Much more information in the toolkit. Please feel free to follow up with any additional questions that you may have.
Wonderful. Yeah. Okay, great. So we're going to take a look at another resource. It actually was inspired by one of the learning collaboratives that Saki mentioned earlier. So this is developing cross-sector partnerships. This resource is available on the Health Center Resource Clearinghouse and also on the respective websites of the collaborators. For this publication, so like Saki mentioned, that would be the National Nurse-Led Care Consortium, the National Center for Health and Public Housing, and my organization, the National Center for Equitable Care for Elders. So this guide was developed to help provide health center staff with tools and strategies to initiate, develop, and sustain community partnerships to better serve, like Saki mentioned, older adult residents of public housing. But this content can certainly be applied more generally to meet the non-clinical needs of a variety of special and vulnerable populations. We certainly encourage you to download this resource and take a deeper dive into the content, but we have a chance in this webinar to just cover a few of the main focuses, which I hope will be a nice setup for our office hours times, where I'm hoping that folks can share their experiences related to partnerships. I do want to just note that we had a few folks in the chat box say, oh, we're actually partnering with more than one type of group. So I would love to hear more when we kind of open it up to general conversation. And certainly, hopefully, this content, this little bit of a highlight will prompt you to ask any related questions you might have. So we can go to the next slide. So Saki mentioned briefly that in our past SDOH learning collaborative activities that have focused on partnerships, we've talked about medical neighborhood maps. And I just want to mention that we've seen through the examples given already today that collaborations between health centers and other community organizations are critical to meet the diverse health and social needs of vulnerable patients. And a great first step in establishing these partnerships is just to identify what are the available resources and to get a clear picture of which neighbors, quote unquote, can help advance patient outcomes outside the walls of the health center. So creating a medical neighborhood map, oh, we can stay on the first, thanks. Creating a medical neighborhood map can help everyone on the health center team understand what resources might be helpful to connect a patient to and give everyone a common point of reference. So this map is meant to be a helpful resource that provides quick access to information that can address potential challenges in the lives of your patients. So no two communities will have the exact same medical neighborhood map, since every city and state is of course different, but the patient or the wider patient population will always be at the center. So we'll show an example in just a minute, but you can see from this slide that there are a variety of ways to approach this. Could be a simple list or a larger diagram or something integrated into your EHR, but no matter what it looks like, creating a map like this has the goal of promoting wellness for either an individual patient or larger population like older adults or residents of public housing. All right, we can go to the next slide. Thanks. So this example was not in our resource, but I just wanted to offer it as a helpful visual. You might be able to tell by the spelling that this map is from outside of the US, but the Agency for Clinical Innovation in Australia has created this image of what they call a healthcare neighborhood. Just think it gives a nice example of a map that contains different health and social services in a defined geographic area. And of course, in yours, you could include the specific folks who might use those services. So it's important to note that no matter how a map might look initially, you'll likely need to adjust it over time as the needs or life circumstances change for patients. You're taking into account their various social determinants of health, or simply the organizations that are around you might change. We can go to the next slide. All right. So we mentioned briefly at the beginning kind of levels of partnership. I just wanted to take a couple more minutes to focus on that for folks. And I am curious to hear from the group again, kind of where you found yourself in these levels of partnerships with folks in your community. But once you've identified organizations that could potentially play a role in patient or population care, you of course want to establish a point of contact there and have a contingency plan in case of staff turnover. Not all partnerships, of course, will look the same, and they can often develop over time with increased capacity to do so or increased levels of support. So it's important to note that there are benefits to organizations involved in any stage of partnership, and they all kind of build on each other. So you can see, you might just start off by simply sharing information. You're not really coordinating anything, but you just want folks to be aware of what every organization is doing. You may start to, in addition to information sharing, start aligning your activities to meet a common goal. And then if you're getting into the cooperating or collaborating stages, this is a lot more formal. You might be seeking to share resources or space through a contract, and then perhaps even creating more of an opportunity to share mutual feedback and keep building the efforts that you can attempt together. So nurturing and maintaining partnerships at any level can certainly have its challenges, particularly if there are limited available resources or poor communication, but tapping into a shared vision and ensuring the missions of all who are involved are incorporated into your joint work can help to overcome some of those barriers. Certainly, we want a willingness to revisit an approach and make necessary changes. That's going to allow the group to effectively work towards their agreed upon goals. So we can go to the next slide. So just briefly, if you've reached that cooperating stage of a partnership, you might be familiar with the process of outlining the needed level of participation and involvement through a formal written agreement, often referred to as a memorandum of understanding or MOU. So there are a lot of examples of these online, so we won't offer just one specific example. The format can really depend on the preferences of the folks involved, but whatever form it takes can help partners have a clear understanding of their purpose, a mission statement of sorts, as well to really target the focus areas for you. It can also help to clarify preferences, even around the words that you're using to advertise a service or talk about the population you serve. So you might decide together that you want to refer to the population you serve as older adult instead of elderly, for an example. This can really help to send a unified message. This written agreement can also be helpful as you navigate various forms of funding, if you're looking at a limited period of time to work together, especially. So we want everyone to be on the same page on whether or not services are going to continue, or support will continue after a loss in funding, whether or not that's anticipated, or if that's anticipated or unexpected. All right, we can go to the next slide. So we don't have a ton of time to dive into evaluating partnerships, but the publication that we're walking through here does offer some questions for partners to consider when looking at the effectiveness of their collective goals and efforts. So for example, who do we want to do this evaluation for? What do we want to know? What targets do we want to reach? And if that's short, medium, or long term. There's multiple approaches to evaluation, from kind of casual to more formal. That's going to depend on the level of available resources and certainly stakeholder expectations. Regardless, the results of an evaluation should be shared with all groups that are represented in an interested and invested audience. So whether that's stakeholders, potential future collaborators, and anyone else who might be affected by the results. Before we go any further, I just want to make sure I see some chat messages. I just want to make sure that I'm not missing anything. Okay, great. We can go to the next slide. All right, so just briefly, this resource did highlight a case study that's particularly relevant since we did have some questions in the registration responses related to partnerships focused on housing. So I'll just briefly mention it, and we encourage you to read more in the publication. But this was an example of a $20 million public and private partnership between a federally qualified health center in Chicago, which is the Olivia Medical Center, a nonprofit community development corporation, which is the Resurrection Project, excuse me, and various entities within the city of Chicago. So this partnership resulted in the creation of Casa Maravilla, a senior center that has 73 independent apartments for adults over the age of 55. And we'll just briefly share on the next slide around the development of this collaboration in its various stages. So a lot needed to happen during the initial stages of this collaborative relationship. Community activists realized that the population in the community was aging and there weren't affordable housing options for older adults. The nonprofit Community Development Corporation was also interested in building a development to fend off gentrification as much as they could. And Olivia Medical Center had agreed to some of its land being purchased if a portion was used for a senior building and a senior center. So the leasing and management of the center is offered at no cost through the generosity of the partners involved, which is great. Once it was established, this unique partnership extended care to over 6,000 older adults in the area, which is great. The staff are a reflection of the community that it serves, both multilingual and multicultural. Monthly wellness programs are able to provide direct health education to participants, whether that's from nurses, dietitians, pharmacists. The Senior Center also works with local schools to help encourage students to work or volunteer with their programs and help build relationships with residents and participants. And older adults are also able to access the benefits enrollment centers to assist with SNAP and health insurance questions. And after identifying that many older adults were receiving misinformation about their eligibility for programs and services, staff were able to help screen participants to determine needs and help connect them with resources. And this partnership, thankfully, was able to continue to grow with the construction of a $15 million environmentally green building with 45 units of affordable rental housing. So that is our little showcase of this case study. I'm going to point out on the next slide that in addition to the few resources that we walked through today, we also have several others that are related to partnerships. For your reference, you'll see the first three are publications from some of the NTAPs that are involved in today's session, and others are external resources, which are still great things to look at around partnership building and assessment. So we encourage you to download those if you are interested. We can take a look also briefly on the next slide. Since all of our groups in this webinar today are involved in many activities related to social determinants of health, especially for special and vulnerable populations, we wanted to highlight some recent and upcoming activities that might be of interest to you. So we encourage especially health center staff to apply for the 2 learning collaboratives that you see on the screen. There was also a very relevant webinar on partnerships that was held, looks like just yesterday, that will soon have a recording available. So be sure to check back on the link provided in these slides soon if you weren't able to attend that live. So we got through content pretty quick. So we have a good amount of time both for your questions, and then we have some questions for you, and we can have a little bit of an office hours set up. So first, I just want to make sure that we're seeing everything in the chat. Any of my other colleagues is there anything we should mention from the Q&A in the chat before we open it up for other questions?
So I'll just, Ariel, I'll just note that what we did was we added a few prompts just to see if folks would be willing to share a little bit of information about what partnerships they may have or what planning or implementation stages they're in right now. Apologies, you all, I'm tripping up over my words. And so we did have some people share. Just want to walk back a little bit and note that while I was presenting, I talked about one example in Washington, D.C. about lawyers housed in clinic, and another example, Crescent Care in New Orleans, was shared. Additionally, in the chat, what was shared about Crescent Care is that they work with multiple CBOs statewide. I know at the beginning, we realized the polling question didn't allow folks to select more than one option. So we did notice that several of you are partnering with multiple types of CBOs and other partners throughout the state, and Crescent Care is one of those, working with multiple CBOs and working at all 3 levels of the partnership stages that you had highlighted, Ariel, depending on the type of CBO. Additionally, Lydia from Tennessee shared that the MLP, the Medical Legal Partnership there is working with Methodist Le Bonheur Children's Hospital in Memphis with a partnership for almost 6 years. They have 4 attorneys, 1 with the hospital, 2 with the University of Memphis, and then 1 with the local legal services agency and herself as a social worker employed with the hospital on the team. They have all office space housed at Le Bonheur, and it's been crucial to have the team on site to help build a stronger partnership. I'll just add a quick edit to that to note that what Lydia noted is crucial is really important when you're thinking about any of these partnerships, right? It's not just about having like a referral, right? Just a cold handoff done to any of these partners within the partnerships that we've highlighted today. It's really important to build sustainability and full capacity baked into your process. So you will be looking at workflows, you will be looking at the EHR for any of these that are highlighted, not just MLP, but any of these that we've talked about today. Because your goal really is to, in a sustainable way, meet the needs of the individual patients, their families and communities, and improve population health. So I appreciate that example. Just the last quick highlight from the chat box, Lauren has shared another partner that I know several of us work with, but there's the Collective Impact Forum coming up, and I think or I thought there was actually there's a forum coming up and scheduled. So Lauren, if you don't mind typing in, because I thought there were some dates related to that, but Lauren has shared in the chat box, I think everyone can see this one, the Collective Impact Forum for Developing and Sustaining Partnerships, and there's also some research that's plugged in. Ariel, that and Bellany and Saki, that's what we've got in the chat. I don't think we have Q&A. Totally
Great.
tongue twisted here.
Yeah, that's awesome. I appreciate everyone sharing so far. We probably can maybe go to our first prompt and see what folks have to say, if that sounds okay to folks. Oh yeah, we do have a couple of other slides just before we transition to just kind of a general time for open discussion. If you're in a time crunch, feel free to take a look at the contact information that's on the slides. We'd love to hear your feedback. This will help us shape future SDOH Academy activities, as well as our individual TTA efforts for SDOH. So feel free to fill out the evaluation that will pop up when you leave Zoom. I believe we'll also email out a link to participants. So we appreciate you taking that time to do that. Yeah, so just a big thank you. All of the, I think we have it linked a few times on the SDOH Academy website, which, like Bellany mentioned, many of you in the virtual room are new to that website. It's a great time to take a look at the previous slides and recordings from the first 2 sessions of this series, in addition to our older content. And certainly the slides and recording will also be available from this session on the SDOH Academy website as well. So that is linked in this slide. And then we can have some office hours. We'll see how much time folks want to chat, but we do, like we mentioned, have some prompts that we can dive in a little deeper with you all. So we appreciate, again, you sharing what you have so far, but we'd love to hear a little bit more around maybe some of your concerns that you'd like to address through either strengthening a partnership that you already have or developing something new. Would love to hear from you all.
So this first question, if anyone wants to go ahead and use the raise hand feature, or perhaps just type in the chat box to let us know that you want us to unmute. We will actually experiment today with unmuting so that folks can speak with us if you feel brave and would rather not chat your response to this first question in the chat box. What concerns would your health center like to address through community partnerships? And if you're not a health center and perhaps you're an HCCN, a PCA, or a legal partner, or another type of organization, and you're working with or partnering with health centers, or perhaps you want to share another perspective related to your concerns, don't hesitate to share that as well. So we have Kim, who is unmuted. Kim, go right ahead. And thanks
thanks for taking my call. I've enjoyed your presentations thus far.
Thank you.
It's a wealth of information, and I appreciate everything that you all are offering us. So I am a social worker at a clinic in a relatively, we represent rural and urban, suburban areas, but I don't hold a position to make decisions. But everything that was mentioned today makes a lot of sense to me. So how would you recommend in regards to establishing partnerships with, and very specifically for us, the housing authority would be very helpful. The local social services would be very helpful. Thinking about the needs that our patients will end up checking off on those SDOH's prepare sheets that we will eventually start doing. How do you recommend starting that relationship or that partnership? And I'll take my response off the air. Thank you.
Sure. Who wants to take a stab first?
Yeah, I mean, I'm thinking that we all might have some thoughts. I mean, certainly it's a fantastic question, and I love that you feel motivated, Kim, to explore ways to start something that maybe that you all haven't tried before. It is tricky if you're one person and you're thinking, okay, we need leadership on board, or we need to find the right levels of contact. I mean, depending on who you want to make the case to first, I'm not sure if it's, also trying to think about who within your organization also might be on board with this idea. If there are examples that you can find, I mean, certainly there's so many great resources out there that we've tried to highlight some today, but examples of how partnerships, whether it's with a health center and a housing authority or other groups, kind of examples of, okay, this is the demonstrated benefit of this type of partnership to make the case to your leadership. And then and finding those points of contact at, whether it's a housing authority or others, of finding someone who might have already been involved in a similar partnership or seems open to it. So it seems like there might be a lot of networking to kind of do, both in connecting with leadership and understanding who the right people are to talk to. But yeah, I guess my first thought is, can we find an example of something that's kind of similar to what you'd like to see in your community that's been demonstrated, this has worked in this way, and be able to hopefully help to make the case to those who would either, help to give a stamp of approval or help to get you connected to the right people, but would love to hear from my colleagues as well.
I'll throw in there for the medical legal partnerships. There are case management meetings that the legal partners have that look very similar to the care management, or perhaps also case management meetings on the healthcare side. And if working in silos and you're not with a partnership, someone, right, is going to go back to one of those meetings saying, for example, Kim, you may, and Kim, I apologize. I know you said you're in social work, but I wasn't sure if you're on a healthcare entity or the like. So if you want to just chat in the box, I'll add a little bit more context for you. But no matter what, right, if you had, let's say, sat in on this presentation, you're going to sit in that case management meeting because you've done, as you mentioned, like all the screenings. Someone's going to wonder, what do we do with this intervention? Because all I keep seeing is high blood pressure, and the clinical folks are saying it's not being addressed, and we don't know where to go to be able to address the real problem that's coming up, which is a housing issue, right? You sat through this training today and you were able to walk away with a tool about how to build the medical legal partnerships. But what Kim is highlighting is she can do all of that, but still needs to buy in from leadership. So we recognize that. And in the toolkit, we walk through the, who would you talk to? If you're looking at the medical legal partnerships, I'm going to talk about a little bit of what I know, but so that I don't mess around with anything Ariel, Bellany, or Saki may have that's distinct from this. But what we would recommend is you get a clinical champion. That's going to be key. Having that clinical provider's voice understand, for example, what you mean when you say we need to talk to a civil legal services partner, because what you're doing in the exam room is you're identifying all of the problems that are social needs and legal needs, but what we really need is someone with that legal expertise who is licensed, or sometimes they don't need to be licensed, to be able to actually address the problem that needs that legal intervention, whether it's in a courtroom or sometimes just saying you're a lawyer is what compels everyone to not go through with the eviction, or to turn around and make the correct decision on the food stamps case or the unemployment insurance benefits, right? Sometimes it's not counsel and advice. Maybe it's just someone on the legal side really helping someone receive the basic information they need about the right path to take or the right information to put on an application. So clinical champions are absolutely key. in medical legal partnerships, and then they can take that. If it's not the CMO, they often though are able to highlight how to help really move forward on formulating a partnership. Can't do it without them. And I say that with the caveat, I don't know, like if Kim, let's say, is on the, I don't know, perhaps somewhere else, right, in the ecosystem of the partnership context that we're talking about. But often, if let's say you're on the legal side and you happen to be at a legal services organization, the concern there sometimes is not having the capacity or resources to be able to do some of these partnerships, right? So legal services is much smaller than healthcare services. So for the health center folks or PCAs on the call, just know that there's a whole lot less capacity on legal services. So you can think creatively about how to get the buy-in by really looking beyond just the legal service partners and saying, what can we do to really expand capacity? Talk to leadership at law schools, talk to leadership at bar associations that are running pro bono or volunteer programs. Those are the folks who can, you know, this is common. This is really not a new question at all. And we know that this is an issue. And so it's about talking to the right leaders or the folks who are sitting with and speaking with the leaders. Kim, I hope that's helpful. Please don't hesitate to type in the chat box. Oh, Ariel, Kim's response, healthcare clinic affiliated with our hospital. Yeah, clinical champion, that physician, that nurse, right, with whom it's going to resonate because they're the ones treating the patients and they want to see the health outcomes. Have that conversation. My recommendation is to have that conversation with that clinical provider who you can borrow 5-10 minutes more of their time and sell the partnership to them.
And I just have a couple of things that I added into the chat. The first is just to build on what Ariel was saying, to build the case for making partnerships to leadership. This is an example. It's got several case studies that shows the impact in terms of, you know, either patient outcomes or cost savings that can help justify, you know, oh, sorry, I got distracted by it. But anyway, take a look at that resource if that's helpful to pass on, as well as a link to an interactive map that we have at the National Center for Health and Public Housing, which shows the location of health center sites and the public housing buildings. And you can see where they are located in the proximity to you. If you hover over the little dots, the contact information will pop up. So you have that contact information there. And also feel free to reach out to myself if you need like an actual name of a person at a place, and I can probably find that easier than looking at a website.
And then I think I'll just add one last point to this, you know, how do you build your case? I think you mentioned, Kim, that you're using Prepare, and I don't know what the practices are around data sharing within the clinic, but if those results are shared, you know, if there are reports that are done, you can really let the data speak for itself. If you're realizing that a lot of the social risk that's being documented is around housing, then that is a good first step to saying, well, you know, we should probably get the housing authority involved. And if those practices aren't necessarily in place, then maybe that's something that you could advocate for, so that, you know, if leadership really does need to see what the evidence is, that's something that you could really add in that I think speaks louder than words sometimes.
And so I know someone in the Q&A also asked for Prepare, and Emily just provided a link to it. It is developed by multiple national training and technical assistance partners, APCHO. Yuriko's on here from NAC. She's one of the Prepare team members. I believe Yuriko, APCHO, and others also highlighted a bit about Prepare on the SDOH Academy's webinar in this series, part 1. So I'd encourage folks to, you know, take a look at that recording. Our colleague Emily Kane is posting these recordings in lightning speed. And so we encourage you to like take a look at that recording, click on the link to really dive deep into the different tools that they managed to share. Ah, yes, and OPCA, apologies for leaving OPCA out of that bunch, not intentional at all. I should also note, oh, here we go. If you all, as someone did, if you don't feel as brave unmuting, please feel free to continue to use the chat. Just make sure so that other attendees can see you using and sending your chat to all panelists and attendees. Otherwise, everyone's not necessarily receiving the benefit. And you can certainly use the Q&A as well. So we're going to scroll to, permission of my co-panelist here, the next prompt question.
Yeah, and I just want to note, since we're just at about the end of the hour, if folks do need to hop off, again, we thank you so much for your time and participation. If you have the flexibility to stay for longer, I don't know if we'll need the full extra half an hour, but we certainly have the flexibility to stay for a little while longer and discuss more about your current or hoped for partnerships. So just wanted to put that note in case folks needed to hop off. Thanks.
Thanks, Ariel. All right, so I'm just going to highlight both of the prompt questions at the same time so that we can make sure, folks who stick around for the Q&A office hours, totally optional, you know what we're asking and talking about. One question, how does your health center currently use data in collaboration? And the previous question I was just highlighted what feels most challenging about maintaining partnerships. All right, so if anyone wants to share, please feel free, go right ahead. And thanks for those of you who are hopping off. We know what these virtual sessions are like. So it's been a lot. Thank you all for attending. Right, for those who are still with us, let us know your questions about partnering or the partnerships, or how to really compel leadership or others.
And my guess is this prompt around what feels challenging about maintaining partnerships. I'm sure that the past year has made this either uniquely challenging, or I think we saw a comment earlier in the chat box about how maybe you were able to make a little bit more of the case about the work that you could do together to address some of the additional concerns that the pandemic was bringing up. So perhaps it wasn't quite as challenging, but certainly if there's something related to the pandemic that you want to share around your partnerships, that also would be really interesting to hear.
Mm-hmm. Looks like Emily also shared that another major struggle is when one person who forms the partnership leaves the organization, so that turnover. Oftentimes that partnership falls apart when that primary lead and developer leaves. To my co-panelist, any comments on that? And then there's also another question in here. Any comments on what was shared about like the turnover that occurs?
Yeah, it's a huge challenge. I mean, I feel like one of the slides that we had that previewed the resource on developing cross-sector partnerships. I mean, even in that, we just kind of briefly mentioned like, oh, make sure the point of contact and a contingency plan. And I mean, but it really is so important because, and perhaps the other organizations wouldn't necessarily know exactly who you would need to contact if that point person were to be gone, but it's a really important conversation to have as early as possible.
Mm-hmm.
I'm seeing comments in the chat box.
Yep. Mm-hmm.
Knowing who the organizational leaders are and who you talk to in regards to sharing ideas for building partnerships. So yeah, that's some of that early work that has to be done of like, okay, I know I want to partner with this organization, but who should I be, who should be the point person for that? And then during the pandemic, we were able to go into our housing and homeless district and offer COVID testing for all the residents when no one else would go. Yeah, that's really, really important work. Thank you for sharing that, Liz.
Let's see if anyone else wants to raise their hand, unmute, and just share what their, because we talked about the COVID-19 partnerships. We haven't been out, we haven't been able to come see some of the work that you all are doing. So is anyone willing to share a partnership perhaps that we haven't highlighted? It's emerging, it's innovative, and they just want to share what they've been able to get done. Maybe there's an unlikely partner that we've all missed. Agreed with Liz, who shared that's amazing to be able to be in our communities and be there for those vulnerable populations. Lauren also shared, I think, a really compelling piece here. Cost savings can be an incomplete measure of impact, or even an erroneous one when it comes to the value of these investments. How have panelists and others communicated value other than cost savings, like investments in health equity, that is? I want to allow my co-panelists to respond first.
Sure. So one of the ways that we've seen health centers demonstrate value in their partnerships with housing authorities and other housing related partners whose goal are maybe self-sufficiency and job creation is by showing how, a partnership between two organizations can lead to an employment of a health center. And that's been done in many cases across the country with CHWs, hiring and training local public housing residents to become CHWs and take their messages to the communities. So I think, value definitely, savings definitely is limited in how it explains value. But if you find the value that is important for that partner, then that can help make the case for, the partnership.
And I appreciate Emily's comment in the chat, and I think that there's a lot of value in patient engagement. So Emily is saying that patients who feel like their health center is connecting them with resources might be more receptive to taking those health messages from their providers, staying consistent with their appointments. I think there's a lot to be said around really helping folks to feel grounded in their community, connected with others. I think there's a lot of value that can be demonstrated in that.
And also, I just wanted to mention that, it might be possible through Prepare to show improvements in quality measures related to partnership building, or at least access to social needs, addressing social risks. If there's someone in here who's a Prepare expert who can explain that a little bit, that would be great. If Eureka or Bellany want to help on that.
I don't know if Eureka, if we can unmute her if she wants to add. I'm not sure she's still on.
I think she left, unfortunately.
Okay,
I know she would be happy to get emails from people, and I'll put her email. She won't mind this at all, I promise. I'll put her email in the chat. If people want to ask questions about Prepare.
That'd be great.
That's awesome.
Thank
and
you.
So that's a very much appreciated. I wanted to just push one step back on the cost savings, right? Because I know it feels icky. I also feel like we can say more than cost savings. Think about how for 340B, right, the savings are supposed to be reinvested for XYZ, right? So I would say, right, go push a little further to redefine or better define or more broadly explain, or just better explain what is meant when we talk about cost savings, right? There are budget hawks out there who do want to see cost savings because we spend a whole lot of money on healthcare in the United States and our health outcomes aren't that great, right? Compared to what we see in other countries with other systems in place. So there is a way to say, yes, our cost savings, right? But go one step further and say, what does that really mean, right? Is it being reinvested like you do deliberately through some programs, such as our drug pricing programs like 340B? You can say, all right, this partnership, what it did was you partnered with a legal partner who managed to get that person rightly covered under Medicaid. And now you are talking about compensated instead of uncompensated care, and actually getting that person to the right care at the right time, managing their chronic care conditions. So instead of going to an emergency room with an exacerbated condition or any condition, because that's the only place they can go, then now that they have coverage, they know where to actually go to manage that condition and adhere to, as Emily noted, planned for care. The diabetic example and food insecurity was highlighted, right? Those are examples where you can show not just the cost savings, or just the real like raw data on money, but you can also show what that really means in terms of population health. Maybe you can use those cost savings to reinvest in programs that aren't covered under like Medicaid or Medicare. You can offer some additional like CHWs to be able to assist people. So I showed the reinvestment of those very cost savings. And of course, there are the non-cost saving related arguments that can be made, like helping a physician practice at the top of their license because they aren't scrambling trying to figure out who is the intervener, like a lawyer, to actually help address the problem, the social needs problem. So those are a couple of quick examples. All right. So we don't have to take up the entire office hour session, but we definitely have pretty sizable groups still with us. And so I just want to remind folks, I can't see it on my presenter mode, but there is a raise hand feature. And it was really nice to hear from someone from the field again when Kim was able to unmute her mic. And so I'd encourage folks, if you feel brave enough to do so, unmute. Let's get back to hearing from each other again rather than typing into chat boxes and stuff. And please feel free, use the raise hand feature so that we can unmute you so you can share your thoughts, questions, experiences, feedback, even on our SDOH Academy series. We're officially over the hump, halfway through, and we've got one more coming up.
Also, if folks are comfortable, I'm wondering too, we asked at the beginning what type of training and technical assistance would be most helpful. And we had a really good kind of like representation across the board, and certainly with live events being the top. But if you are thinking specifically about partnerships and all of the intricacies that we've kind of touched on briefly, if there's an element of partnership building or maintenance that it would be helpful to have future activities on, I'd love to know that as well, because we can keep that in mind for future years. Yeah, so let us know.
Feel free to chat your response to what Ariel mentioned in the chat box. If you can't find the raise hand feature, to let us know what your needs are, what you want to see in the future, feel free to send it in the chat box or even to use the Q&A. There's so many functions in here. All right.
Yes, and thank you, Emily, for putting the link for the final webinar. We certainly hope if you haven't already signed up for that one that you will join the group.